If you want to know three things you need to know to treat CrossFitters, you have to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know three things you need to know to treat CrossFitters, you have to tune into this episode. Before I go on to the podcast, what is new in life? I always like to share my personal updates. My son, Zach, is the question king at the moment. Hey, Dad, why does this happen? Hey, Dad, why does this happen? Why, how does a snake, well, okay, so here's an interesting one. Here's why does a snake why does it leave its skin or uh, like he's like, well, then how does it shed its skin through its mouth? Like what at what layer? So he has just gone off on these questions. And so I am Googling a lot of things at the moment. This is I've never thought of that before type of phase. So he's asking questions. Jacob is just crushing the walking, and Alex is just being an amazing human, just being a good helper around the house. What is happening personally from a fitness standpoint? I hit a milestone. I've never done this before. If anybody knows, that's what I'm talking about. CrossFitters. I do CrossFit or functional fitness, whatever you want to call it. And I, for the first time, did 30 bar muscle ups without like approaching the bar. It was like being underneath the bar. So big win for me. If anybody knows how hard that is or challenging, especially if you have like no gymnastics background, it is tough. So on the sports performance side, what's happening? If anybody's here locally in San Diego and you want to come meet me and the team, or maybe you thought about, down the line that you're looking for different opportunities, or you want to come network with us and meet and greet. Come down. We're having a Fit Fest. It's our first annual Fit Fest. It's our eighth anniversary as a company, and I am so blessed and I'm excited to share with everybody. So that is happening October 1st, 2022, in San Diego at our Chula Vista location, right behind it. So I'm excited to see you guys there. What else is happening? We just hosted a foundations webinar. That was fantastic. I had people from all over the country listening to just what is it that you can do to expedite healing and get athletes back to sport faster. So we just did that. For those of you who have been asking, yes, my next upcoming course is the barbell course that is on October 15th and 16th, 2022. There is a hybrid component to that. So for those in San Diego, it is at our San Diego location, and it is going to be online as well. So if you love to work with barbell athletes, or you don't know how to do it, or you've never touched a barbell, or you're an expert in a barbell and you're like, I want to fine tune the mechanics, I want to do all these things, this is the course for you. So all right, on to the podcast episode. All right, what are we talking about today? So CrossFitters are a different beast. And what I mean by that is, I don't speak French. I don't speak Italian. I don't speak Chinese. And CrossFit and these community-based groups or workout regimens, so like F45, Orange Theory, they speak a different language. I've never been to an F45 group. I've never been to an Orange Theory group, but I know that there's internal lingo, there's terminology that comes associated with that camp, with that group. And so if I was going to go into treating a lot of Orange Theory patients and athletes, I would have to learn that lingo. And there's a lot of things that I'm going to share with you today that I think you need to know when you work with these individuals. Now, Instagram, social media, and all these other things have open the gateway and networking opportunity for CrossFitters to seek out their own care. And that's what I think is changing the game for medicine and health and healthcare in general. And so these individuals are, yeah, they understand like maybe what their insurance limitations are, whatever it is, but they're going to seek out the best quality healthcare provider for what they want. So there's a couple things that you need to know when they come into the office and they want to get treated by you for a specific thing. I think that you need to be better prepared. I think that what has got you here is not going to get you where you want next. And I tell that to a lot of people that they think, well, I've already done PT school. I've already done this. Like they should listen to me. They should just like do their homework. They should just like listen to the healthcare provider. I'm the boss. That really doesn't work anymore. That it really doesn't with social media and everything else. I think people are more informed and they know that as a customer that they expect a certain amount of service, a certain type of service. And part of that service is being an active listener and not just like, well, I don't care how you do it. This is the way it's going to be done. I think that style of parenting is also phasing out as well. And I know I'm working on a lot of things as a parent, and one of the things I'm trying to do is become more of an active listener. And I want to I think that it translates to your spouse, your marriage, your coworkers, and I think that if you can have an active communication with people, I think it helps you across the board. So this whole top-down approach from like physician to patient or healthcare provider to patient is changing a little bit more lateral, and that I think you need to understand that these CrossFitters are looking for specific types of care, and I want to be able to set you up for success. So the reason why I did this podcast, why am I doing it? Because I think that the more athletes I talk to, the more I understand that they're searching and seeking something, and they want more than they're getting. And I get people all the time, probably on a daily basis, coming up to me, "Hey, Chris, can you like take a look at my shoulder?" I'm like, "Yeah, it's fine, but like, what's the real root? Like, why haven't you had this fixed?" They're like, "Oh, because I went to PT somewhere else. I did, I did massage, I did all this other stuff. I did chiropractic, I did acupuncture, I did all this stuff, and they just can't seem to fix it." And when we go through things, I'm like, "Oh my gosh, that's so simple. Just like reduce the overhead and do this and blah 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 and take this out." And they're like, "Oh my gosh, I wish that person would have been able to tell me that, because that would have like prevented me from wasting all this time." And when I hear that, I'm like, "Oh, I see. It's because some providers don't understand some of the differences between some of these individuals and what they're seeking." And I think if you understand what they want and are looking for, I think it'll help you better treat these individuals. So whether you're a new grad, you're established, you're a veteran, you're a master clinician, I think we can all improve. And this is one domain that you have to, because these individuals, depending on your population and where you treat, will and continue to represent a large portion of patients and athletes that can come to see you and need your help, and you need to be able to service them appropriately. So here's three things. Okay. Number one. So these individuals aren't okay. They don't stop. Number one, they don't stop. Meaning, shoulder pain is not going to stop them from working out. Back pain is not going to stop them from working out. Foot pain, knee pain, it's not going to stop them. I promise you, it's not. They will continue to do it against your medical advice. So you can either get frustrated or you can solve the problem. And you as a provider, it's your fault. You have to understand this. It's your fault. The reason why they're not listening to you, it's your fault. Number one, they don't stop. So how do you fix that? If they're not going to stop, how do you accommodate that, right? So how do you work with them, right? And this gives them a bad reputation, like, oh, the CrossFitter, they're going to go and do 1,000 burpees and blah blah blah. It gives them a bad reputation, but I think what you have to realize is like what drives them is the intensity. Going to the gym, there's two components. There's intensity and community. I think personally that I've gone through this, I've been in it for several years. There's two things that drives a CrossFitter: intensity and community. They love the community. They're not going to stop. It's kind of like their social hour. So you need to know they're not doing it for exercise. They're doing it for community as well. Number two, they're doing it for the intensity. They love going hard, going fast, and they won't stop. So how do you work with somebody who wants to be part of a community and wants to go hard and fast and won't stop? That's the question. That's the question is how do I work with a CrossFitter? It's how do I work with somebody who wants to be part of a community and will continue to be part of a community despite being hurt and wants intensity and will continue to go past pain. All right. So that gives them the bad reputation. But how do you work with them? They need modifications. They need modifications. They don't need, if you were part of any of my courses, if you were part of the Foundations webinar, these individuals don't need just red lights. They need yellow lights, meaning red lights to me, there's green, yellow, red lights. Those are my bumpers that I provide to people. Red lights are like, well, don't squat, don't deadlift, don't go to the gym, stop doing that, don't jump rope, stop doing box jumps, don't overhead press, stop using your shoulder, stop breathing. Those are all red lights. And CrossFitters don't like the red lights. They won't work with you if you continue to just give them red. Now, the opposite is if you give them greens, it's too many questions. You're going to have that person calling, emailing you. Don't just give them greens. Don't do that. Like, okay, yeah, it's okay to go ahead and squat. Okay, like to a box, or like how far? Like, I mean, can I go 5 days a week, 3 days a week? And it'll continue to tell them, it'll continue to fuel the questions. So don't give them just green lights. You got to give them yellows. And this is where the skill as a clinician comes in. So the red is don't do that. Okay, you can only provide a certain amount of those before they're like, well, then what can I do? Then you give them too many green lights and they're like, well, that's going to continue to just bother them and like ask more questions. So you got to give them yellow lights, meaning you can squat, that's a green. However, to a box, that's a yellow, 3 days a week at 75% or lower of your 1 rep max. Oh, okay, I can do that. Perfect. You cannot jump rope for 2 weeks. That's not a red. That's a kind of a yellow to red because you're giving them at least like they can see the roadmap. And shoulder press. You can't press a barbell overhead, but you can press dumbbells, neutral grip, close to your body, and single with a light load of 20 pounds or less, 2 days a week at 50 total repetitions. Okay, I can work with that. For how long? 2 weeks. Sounds good. And all you're doing is you're helping them understand when they can go back to the community and intensity. And so I think if you can, they're not going to stop. That's my first point. They're not going to stop. They don't stop. So that gives them the better reputation. And number 3, you got to be able to adapt to that. If you don't, you're gonna lose them as a patient and athlete. I think that's the worst thing ever. Like, why would you lose a patient or an athlete because of your lack of education or awareness? I don't know golf, but you better believe I'm working with a golf athlete, I'm going to speak golf. Sure. Sorry, Mrs. Johnson, when are you playing golf again? I've never played golf before. Will you please help me understand what happens on that like first drive? Can you explain that to me so I can better understand the mechanics? Perfect. I'll tell you what, you're moving forward, your back hurts or your shoulder hurts. So I'm not going to allow you to have a full rotation. So you know what? You're not going to be driving. You're only going to be doing chipping and putting for the next 2 weeks until we can get your pain down. That I've never stopped you from golfing. I'm telling them right there that I'm not telling you to stop. I'm telling you I need 2 weeks of I need 2 weeks to buy me some time to not flare this thing up while I work on that stuff. But I'm still allowing you to chip and putt. How often? 3 days a week. I normally do 5. Okay, perfect. Can you bear with me and just do putting 5 days a week? You can putt. 3 days a week you can chip, and you have no driving for 2 weeks. Oh, that's fair. I can totally do that. Now I'm working with you. Now I'm speaking golf. These people don't want to stop. All athletes don't want to stop. You wouldn't want to stop. So it's funny, as a provider, you don't treat your patients like you would yourself. And I think a lot of people are asking for that, regardless of age, whether it's a 60-year-old CrossFitter, an 18-year-old golfer, or a 35-year-old mountain climber. I don't know, whatever you want to call it. So that's point number 1. As a clinician, this will set you up for success to have a better communication. Number 2, in these like people's world, these CrossFitters, pain-free doesn't exist. Pain-free doesn't exist, meaning you and I will go to the gym and we have a little soreness, so we back off, right? These people live with soreness all day, every day, and they love it. Why would you try and change that? So, and this is the caveat. So those of you who've been in, you lived in the insurance-based world your whole career, or you've done internships, you've done all this stuff, and you're like, well, Chris, the insurance is telling me I need 100% pain-free. I understand that. Here's what I would say. You got to have a different discussion with the CrossFitter. When you say pain-free, like find out what their baseline was before they were pain-free or before they had the shoulder injury. So if you ask them, I understand you have 7 out of 10 shoulder pain. Great. Before you started developing this that's limiting you from CrossFitting, What was your baseline level of pain before? Well, I always had like a 1 or 2. Great. Now I know. So you were never pain free? No. So how can I expect you to get back there? So your question becomes, how close are you to a 1 or 2 out of 10? Because that's your baseline. That right there changes the game because they now understand like for you to get pain free is going to take you like 10 years. And it's only momentary. These individuals live with soreness and they're okay with that. So you as a provider, when you're like, well, let's get you pain free, they're like, yeah, sounds good. I'm gonna still work out. Like I'm not gonna stop. And so the way to reframe that is, okay, great. So what was your baseline level of soreness or pain before having this thing that stopped you from CrossFitting? That's the discussion that needs to happen. It's not what pain-free is. It's everybody, you and I walk around this planet with pain. Like my back is tight. My thumb started bothering me the other day. My toe hurts. I mean, there's always random stuff. My knee's achy. All right, but that's not stopping me from doing activities. When the reason why people seek out help is because it stopped them from doing activities. People don't stop doing activity because they have pain. All of us have pain. Every single one of us have pain, but it doesn't stop you, so you don't seek out help. The people who have come to see you, it's because they've already had this like timeline where finally it's interfering with something in their life. It's not that they had pain-free lives before. They didn't wake up and they had like 7 out of 10 pain. They had 1 or 2, then it went up to a 3 or 4, then 5 or 6, and that 5 or 6 is what stopped them from doing the activity that they love. So you just need to figure out, well, what's their baseline level of soreness or pain? Great, you have 1 out of 2 pain. Let's get you back there. Can I get you back to baseline? Is a good way to look at that. Not pain-free because it doesn't exist. There's a company out there that's CrossFit specific that I think literally it's called Live Sore. I don't know if they're around anymore, but live sore is a thing, meaning you're going to just live sore with soreness. And that's what CrossFitters do. Don't try and change them. Don't talk about them behind their back. It's like, how do you know if like a vegan is a vegan? They're going to tell you. If you, how do you know somebody's gluten free? They're going to tell you. How do you know if somebody's a CrossFitter? They're going to tell you. So don't try and change that, right? Like it's who they are. And if they're a golfer, they probably talk about golf all the time. Yeah, I'm not trying to change that. I'm trying to be part of your life so I can help you get back to baseline. So that way you can modify over the next 6 weeks. My job is to modify and get you back to your baseline, and that's it. My job is not to correct your perfect movement, get you to a perfect swing and a perfect snatch or clean and jerk and be pain-free. Impossible. So the premise of our profession is faulty. It's not that we can improve your movement 100%, get you back to where you want at 100% pain-free. Impossible with athletes, especially CrossFitters. You're just trying to get them back to baseline without the movement problems that they were having before. And I think if you understand that, that helps you understand, well, what am I doing for this person? So number one, they don't stop. Number two is pain-free doesn't exist. What that does is it really changes your approach to discharge. Well, how am I discharging them? Well, get them back to baseline. Prior level of function, not 0 out of 10. Prior level of function. What was your prior level of function? 2 out of 10 pain, going to the gym 5 days a week. Get them there. That's it. So you're not discharging them because they're not pain-free. You're discharging them because they finally got to prior level of function and the goals they wanted to hit, even with a baseline level of soreness or pain. That's okay. It just changes your framework. I'm not telling you to change your practice. I'm telling you to change your awareness of how people come in so you can better support them. The problem with most PTs is they assume that the patient or an athlete knows exactly what you do, and they assume that every patient or athlete wants to get 100% with 100% quality of movement. They don't want that. People don't want to be pain-free. They don't want 100% movement. That's not what they want. So stop trying to deliver on that. What they want is, I just want to be able to do the thing I was doing 6 months ago before I met you. I'm not trying to like if you go to a I don't know, your accountant and they're like, hey, I want to do my taxes and I just want this, and they're like, oh my gosh, I'm gonna clean all this stuff up, I'm gonna make you look, and they're like, you're like, I don't care, I just literally want to be a physical therapist, enjoy my life. I don't want to be like a perfect numbers person. I literally just want to enjoy my life. Can you just help me get there and like give me education along the way? That's all you want. You want a simplified version that doesn't speak Chinese to you, that speaks English in your language, which is CrossFit speak a little bit of CrossFit, speak a little bit of golf, speak a little bit of baseball, speak a little of volleyball. That's it. There's no difference. And the minute that you speak PT to a CrossFitter, you're not speaking CrossFit. That's where PTs lose the battle most of the time. They start speaking PT. Well, the inferior portion of your left gluteus minimus is lacking a little bit of strength. It's a 4 minus, so that's why you can't move into external rotation. That is really limiting your ability to perform. And they're like, what the heck does any of that mean? Your hips are weak, and we need to move your legs out just a touch, and that way it'll help you drop into a full squat. Oh, that makes way more sense to me. So understand the way that you approach these people is probably the best thing you're going to get from this podcast, from the information, to be able to better serve them. That's all you want. Really, that's all you're looking for as well, as a provider. It's just a couple golden nuggets where you're like, that's a piece I was missing. So number 3, this is really a summary of everything I've been talking about. Learn their lingo, please. So number 1 was you need to, they don't stop. Number 2 is pain-free, doesn't exist. And then learn their lingo. You have to. It's at some point you have to undo what PT school did. Like PT school trained you to like be this robot, right? Like inferior, sagittal, frontal, blah, blah, because you need to speak internally to staff and insurance. That's insurance and staff lingo are one thing. And then like you get out of that bubble and then you hit like community members. That is a different bubble. You can't use insurance and staff lingo with patients and athletes. They're two different worlds. And I think a lot of times PTs do that. And I have, my son is in elementary school. So I can't imagine the teacher trying to speak adult to a child in kindergarten. So that person, that teacher, has to be able to modify that and speak child to my kid. And so that's what you're doing. You're translating PT and insurance, and you're filtering it down to like first grade level to the consumer, so you can speak consumer. And so you got to be able to learn their lingo. Learn what a modification is. Learn what a hang position is. Learn what a high hang position. Learn what a clean is. Learn what a snatch is. Learn what a snatch balance is. Learn what a split jerk is. Learn what a push jerk is. Learn what a shoulder press is. They're all very different things, and you don't need to be an expert, I promise you. But the minute that you can speak a little bit, they're like, oh my gosh, how does that help you as a clinician? Better buy-in, and they will listen to you. So when you say, hey, Chris, CrossFitters don't listen, they don't stop. Great. Why don't you change your perspective and say, oh, CrossFitters don't stop. And the reason they don't listen is because I'm not speaking their language. And if I can just modify my discharge approach and my approach to them, they will actually listen to me better. Yes, you're teaching or you're speaking PT and insurance terminology to a consumer that doesn't match. That's all you're doing. And sometimes people have problems with patients and athletes not being able to execute, not doing things. And CrossFitters are no different. And I think that you have to speak their lingo. So you'll get better buy-in. So once you do all these things, you understand that they don't stop, pain-free doesn't exist, and you learn their lingo. Wow, think about this. You'll be able to provide modifications. It'll change your approach to discharge, and you'll have better buy-in. Guess what? Better outcomes. So sometimes I think that clinicians sometimes look for the holy grail. They go to Con Ed courses to look for like, why aren't they listening? Like, what is it that I need to do? What exercise do I need to do? I'll tell you what, it's not the exercise. It's rarely the exercise. Rarely, like 1% of the time it's the exercise. It's usually your ability to communicate the delivery of the exercise and how it's going to impact them and implement into their world. So I think if you change that, the exercise is not irrelevant, but it's less of a priority. So it's not that you're learning the best exercise, you're learning how to work with this individual so that they're successful. So those are my 3 things on 3 things you need to know to treat CrossFitters. And if you are like, Chris, I want more, I want to be able to do these things, or I've been doing it, but I need to fine tune a couple things, whether that's my communication, my exercises, my awareness, and my mechanics. That's why I built the management of the barbell athlete course. So the management of the barbell course, management of the barbell athlete course is really just going through weightlifters and CrossFitters. So like people who do Olympic lifting, maybe powerlifting, anybody who touches a barbell. Um, you need to know how to manage these individuals. It's very different. Like, well, what do I do? What if I change their training or volume? What do I change their intensity? How close are they to a competition? What about strength conditioning? What are I like? How do I modify that? What if they have a strength coach? These are all questions that come about when you start working with individuals who enjoy barbell mechanics. So when you work with these individuals, it's a different beast, and all you have to do is change a couple things. And so I built it because I had a lot of clinicians ask me the same questions, and so that's what I want to be able to share with the PT world. So if you're interested, there's two components to it. There's a hybrid component, which is there's an in-person portion at our San Diego location, October 15th and 16th, or you can do it hybrid, remotely, virtual. I've done it before. It's my third year doing it, and there's been numerous people who've taken it virtual and they love it. You'll still be able to get the mechanics. We'll have a great team to be able to help you out to do that. So if you're interested, sign up. It's drchrisgarcia.com/barbell-course. Go ahead and sign up. Registration is now live. I only take about 10 people in the course in person, just because I want to be able to provide a high level quality of like individual mechanical review. So if that's of interest to you, sign up. If not, join me on the webinar leading up to that. That's October 11th at 5 to 7 p.m. Pacific Standard Time. And I'll have a sign up soon. And then go and register for the webinar, learn about the mechanics. Is it for you, or is it something that you need to be able to implement? Will it help you with your patients and athletes in 2022? That's what you have to decide. All right. For those of you who are interested, I'll see you at the event. If not, I will see you guys on the next episode. Take care.